Hello, Amrish Patel. We're now going to sort of mark the face, mark Nadine's face here, and we're going to do a mid-face filler in the cheek area. So the anatomy here is that, and I would encourage all of you, if you particularly when you first start off doing fillers, to try and mark the face and know exactly where you are and where the needle's going to be. It's very important. Of course, it goes without saying, you need to know your anatomy and the vasculature so you don't do any harm. In the mid-face fillers, our goal is to try and reflate the fat pad in the cheek area here, and the markers are that you go from the bottom of the nose here to the top of the ear, and a line across there, and then look. You can open your eyes, and the lateral ciliary margin, a vertical line directly down, so you get a spot there, and that is the spot you're heading for. Filling in this area here and perhaps a little bit here. She's also got a nice zygomatic arch here. A good arch really does help to lift, and also it just looks aesthetically very nice. So this is the goal area here which we're trying to fill, and the approach would be from here with the filler being delivered in this zone here. I've already sort of set out the filler here, and I'm going to start filling. So Nadine is very comfortable at the moment. She has had her nicely numbed up. She's not feeling apprehensive because she's had this done many times, and I will, the target zone is here. I'm going to approach it from the inferior lateral side, needle in, bevel up or down, but this is a deep injection, and you go next to, quite near the periosteum, go straight in there, in the zone here which I'm targeting. Aspirate to make sure you're not in a blood vessel, and it should be a very easy push. Now needle selection is very important, and as you can see I'm just pushing it in very gently, and it's reflating this area, and you're doing around this area, so just go slightly laterally as well and most of the filler should be delivered in this area. And already as you see me doing that, you can see the cheek is lifting. Remove the needle. Try to make as few needle insertions as possible because it does bruise. It can bruise and leave a mark, and it's more uncomfortable for the patient, but you can see she's very comfortable. Okay, and reassess, have a look at where you are, and make sure that you're in the right, the symmetry here. Mold it a little bit. Let's do that again. Is that okay? Okay, very good. You're still very comfortable? Always keep on checking with the patient to make sure they're comfortable. And, it's a fanning sort of, but you're really deep in there, pushing on there and molding it. Sometimes I use a cannula to do this, and the cannula is a very nice way, which I'll demonstrate in the temporal sulcus there, way of filling. Wonderful. As you can see, there's two sides here. She's got a nice lift on here. I'll also go a little bit along the zygomatic arch, just give her the lift here, but there's a nice filling here. Okay. And for zygomatic, it's just a matter of giving little boluses along. Again, are you comfortable there, Nadine? Little deep boluses. Wonderful. No bruising, no bruise, just gently mold it. And as you can see on these sides, there's a nice little filling here with a nice zygomatic arch here. Okay.